The Catholic Church has decided to end a 92-year-old relationship with St. Charles Medical Center. I'm Dave Adams. Cascade Healthcare Community's Jim Deagle says the operation of the hospital will remain the same, but there will not be a formal relationship between the Catholic Church and St. Charles. Bishop Robert Vasha speaks for the Baker Diocese of the Catholic Church.
St. Charles Medical Center has traditionally been identified as a Catholic institution. As a Catholic institution, it's a title which really I am responsible for, and I give that title to those institutions which fulfill all of the statutes required of the Catholic Church. And the decision was that some of the practices at St. Charles are incompatible with the teachings of the Church, and that it would be misleading for me to continue to identify it as a fully Catholic institution, and so I have withdrawn sponsorship of the Catholic Church to St. Charles, and it is now a standalone regional hospital.
What medical practices does the Church have a problem with, and why?
Well, the main one, as is indicated in the press release, is the contraceptive sterilization. Sterilization is a permanent making infertile of a woman, and it is viewed by the Catholic Church as a mutilation kind of surgery, because we do not believe that you should take a perfectly healthy portion of the body and remove it or destroy it.
You say that's one of the issues. Has there been some others?
There have been some others, but that is the primary one because of the frequency and confusion concerning that particular practice in this hospital.
So do you financially, how do you support St. Charles Medical Center?
There really has been no financial benefit or contribution either way from St. Charles to the Catholic Church. It has operated independently really since about the 1970s.
So this is kind of a name only and
in many ways, yes. It is name only, but it's also title in the sense that people look at the hospital and are now hopefully not confused by reading on one hand in the Catechism that the Church does not permit sterilizations, and yet sterilizations are being done in this Catholic hospital. That's a conflict and a contradiction that I could no longer tolerate. I trust that the relationship between St. Charles Medical Center, and will retain the name St. Charles, and the Catholic Church will remain cordial, and that the Catholic Church is still available to the hospital for ethical consultation or for questions or for encouragement and support.
CEO Jim Deagle of Cascade Healthcare Community says that the operation of St. Charles will be unchanged.
Obviously, both Bishop Vasha and myself and the board of directors here at CHC have a degree of sadness clearly around this development. And it's actually ending the Catholic sponsorship of St. Charles Medical Center Bend, which has been in place, as you know, for over 90 years. Originally came about when the Sisters of St. Joseph of Tipton, Indiana, founded the hospital back in the mid-19-teens. And it basically just says that official sponsorship and our strict adherence to the ethical and religious directives or the Catholic health directives of the Catholic Church just no longer will continue to exist per se.
So you're going to rewrite the directives?
Well, one of our goals is that in our long discussions with Bishop Vasha, because both parties clearly did not make this decision very easily, but our goals is as we move forward, we hope to use the ethical and religious directives of the Church to really become foundational for our ongoing ethical and clinical directives of programs and services here on the Bend campus. And that will take a little bit of work on our part over the next couple of months, but if I could really adequately describe this, you're not going to really see any fundamental changes in the care or the philosophy of care or how we do business or changes in programs and services really as a result of this announcement. It's just an acknowledgement by both parties that the historical sponsorship just is not working going forward. But we intend to take the great work and the excellent foundational elements of the ethical and religious directives of the Catholic Church and just move them forward, but we'll own those ourselves versus having the Church sponsor them.
Jim Deagle of Cascade Healthcare Community, St. Charles Medical Center. I'm Dave Adams. Take 5 is a production of 1110 KBND Radio News. Depend on us.